Orillia Soldiers Memorial Hospital, over the last number of weeks, significant changes have taken place in terms of how we are preparing and how we are responding to COVID-19. So first and foremost, we continue to provide all the emergency care in our hospital. Our emergency department is staffed, and we encourage people, if they do need care, to come in for care. We have also made a number of restrictions in services and access for people's safety. We've limited the number of procedures and surgeries to restrict that to only those that are deemed essential. Hopefully, we can limit the amount of movement of people within the organization, and we also preserve our resources, and it helps us build capacity in the hospital to be able to respond to COVID patients. We've also limited the amount of visitors. So generally speaking, there's a no visitation policy except for exceptional circumstances. And we want to encourage the public. We recognize how difficult that is to work with us and help us identify how we can best connect our patients with their loved ones. Currently, we are operating at about 70% occupancy, which is fairly common across hospitals in Ontario, in the sense that because of the reduced activity, we do have additional capacity ready for COVID-19. And we have seen a number of cases through North Simcoe, Muskoka. We have seen a number of cases through Orillia. Currently, as of today, we don't have any cases that we're aware of internally as inpatients with COVID-19. In response to COVID-19, we've spent a lot of time with our staff to ensure that they remain safe. So we have a very strict protocol around symptoms. So if our staff have symptoms, they have immediate access to testing. They are off until they are cleared. All the safety steps you would expect. We are actively monitoring, so staff coming in every morning need to sign in, and there's a check for symptoms, fever, etc. So we are asking our staff to take all the necessary precautions, like we are asking everyone, but I think a higher level of vigilance in a healthcare setting for sure. The staff have been really taking the opportunity to train and retrain and prepare our responses. We haven't had a significant need to respond as some areas of the province have had to. However, we are continuously looking at how we can make sure our staff feel comfortable, feel safe in the environment. And I think the staff overall are doing very well. They're very appreciative. There's been some very kind gestures from the public, lots of understanding, lots of appreciation. And I think that motivates our group to continue to do everything we can to serve this community. The situation at Orillia Soldiers for personal protective equipment has gotten better over the last week or so. We've seen the Ministry of Health release more supplies from their stockpile. The supply chain is moving a little bit better, so we have approximately 30-day supply on all the essential equipment. We think of masks, we think of gowns and gloves, as some face shields, as some of the essential equipment, and we have a very close eye on that. It's something that we know can change over time, so we're working very hard to continue to have those supplies available, and we're also working with our partners in the community to make sure that our partners have enough supply, and we've been able to help out in certain circumstances to ensure that as a community, we're all looking after each other. So we've recently received new information, provincial modeling of the COVID pandemic in Ontario, to show that the very difficult, very strict public health measures, physical distancing, hand washing, seem to be working. They are making a difference, and that's a credit to everyone in the province that's stepping up and doing their part in not congregating, staying at home, in keeping distance, the 2-meter distance. The key message here is we cannot stop. It seems to be working. Why would we change? I absolutely plead with our community that as hard as it is, the curve seems to be flattening, but COVID is still here. We need to keep absolute diligence on that, and we need to pay attention to the experts, the public health experts. They will advise us when the time will come when we'll be able to relax, but until then, I think any success that we've seen has been a result of very hard work, and we need to continue that to have the continued success. Well, on behalf of the hospital, the staff, the physicians, all of us, I really would like to thank the community. This is something that the success at the end of this pandemic, the success will be defined of how we respond as a community, how we support each other, how we follow through on the difficult steps we need to take. And I just want to thank everyone for doing their part and supporting each other. And for those that are struggling right now, they will not be forgotten. We'll make sure that the community gets back to where it needs to be. But for now, we need to stay the course. So the communication across partners and levels of government has been quite good. I would say initially it's very difficult in these situations. We are all dealing with uncertainty. You get into a rhythm of understanding how we reach out to each other, how we communicate, and that helps. It helps our staff, it helps between facilities to be able to share the most recent information, to be able to share some of the local challenges that are being experienced and how to help problem solve. So I would say we continue to get better at reaching out and forming new and different networks as this pandemic unfolds and as some of the challenges, as we see new challenges come up. A good example of that more recently is we are seeing that our long-term care facilities and retirement homes are a very high-risk area. Any kind of congregate living is. This is a very vulnerable population that we need to pay special attention to. So over the last number of weeks, Orillia Soldiers has been working very closely with those facilities to see, and our family doctors and other providers, home and community care, to make sure that we are supporting everyone in an equitable way. And that's the kind of network that can help prevent major catastrophic events from occurring. We need to be very diligent in that, and where I believe some of the partnerships can really stand out and help keep everyone supported.